My dear viewer, I want to take this chance to welcome you to Home Aid Training Center. We are located in Federal Way, Seattle, Washington, United States of America. My name is Dr. Stephen Jenga. I am the Managing Director of Home Aid Training Center. And today I want to talk about what we know about COVID-2019 as it is popularly known. And many people, they are wondering why is it being called COVID-19, and hence we are in 2020. And just maybe to give you a background of what is going on and what are we supposed to be and where are we at, maybe this is what I would like to discuss today. And therefore, walk with me in the few minutes that I'll be here, and I believe you're gonna get more informed. And the 2019-2020 coronavirus pandemic is an ongoing pandemic, or coronavirus disease 2019, which is popularly known as COVID-19. It is caused by severe acute respiratory syndrome, or coronavirus 2, SARS, or COV2. And that is what we know. The outbreak was identified at Wuhan in China in December 2019 and declared to be a public health emergency of international concern on January 30th and January 30th, 2020. And it was recognized as a pandemic on March 11, 2020. So, as of today, April 2020, more than 1.77 cases of COVID-19 have been reported in 210 countries and territories. So, resulting to more than 108,000 deaths and more than 402,000 people have recovered from the same. So that is good news. That means that we are winning against this pandemic. And also we need to know that how this disease is being contracted. Although there may be a possibility of reinfection, the cases fatality was estimated to be 4% in China, but it varies significantly between countries. So each and every country, each and every territory, they have their own fatality rate as it is going on. The virus mainly spread between people during close contact. That's why we have been advised by the government, we've been advised by the health professionals to observe what we call social distance. Often via small droplets, that's how you get it. Small droplets are produced during coughing, or sneezing or talking. So while these droplets are produced when breathing out, they usually fall to ground or surfaces rather than being infectious over large distances. So if you keep distance, quite social distance, then you cannot get it. People may also become infected by touching contaminated surface. You have to identify those areas like door handles, shopping carts, money, when you go to you use the washroom. There are so many handshake, greeting each other, so you can easily also contract the virus through those ways. So while these droplets are produced when breathing out, they usually fall to ground or surfaces rather than being infectious over great distances. So people may become infected by touching contaminated surfaces, as I said earlier. So the virus can survive on surfaces up to 72 hours. You can imagine. So you cannot just touch something, and if you do not observe proper hygiene, then you cannot say that you are clean in one way or the other. You can still contact the disease. So when they fall up to 72 hours, they can still be able to infect you. It is most contagious during the first 3 days after the onset of symptoms, although spread may be possible before symptoms appear and later stages of the disease they can be seen. So let's talk about what are the common symptoms. The common symptoms include fever. You may have fever, you may have cough, dry cough, shortness of breath. Complications may include pneumonia and acute respiratory distress. You are not able to breathe. So acute respiratory distress syndrome. So these are some of the symptoms. So the time from the exposure to the onset of the symptoms is typically around 5 days. So that may range from 2 to 14 days. There is no known vaccine that is known to treat this virus. So there's no vaccine right now. So primary treatment of symptomatic and supportive therapy. That is the only way. And some of these preventive measures is what we've been told. One, to observe social distance. That is number one. And number two, you avoid handshakes or greetings. You avoid that. And also you make sure you're using gloves. It's important to use gloves. Very important to use gloves, to use masks, and also stay at home, because that is one of the ways that we can prevent ways of spreading germs from one person to another. So the recommended preventive measures I've said is you do hand washing, and when you do hand washing, wash your hands the proper way. Make sure you put the water in the right room temperature, and then once you wet your hands above your wrist, you make sure you wet your hands above the wrist, and also you apply plenty of soap and you writhe your hands from 15 to 20 seconds. Make sure you wash your hands properly. Wash your hands properly. Wash your hands 15 to 20 seconds. Wash everywhere. Make sure you wash your nails. Make sure you clean them properly. Clean your nails everywhere. Make sure you are touching every area of your hand where the germs could be hiding. And once you have done that, then make sure you rinse your hands properly, and then you dry them with a paper towel. Make sure you dry your hands with a paper towel, and then you dispose properly the dirty towel so that you will not contaminate more surfaces and get people sick. So proper hand washing is very important. Proper hand washing is very important. And then you cover your mouth when you're coughing. Make sure you cover your mouth when you're coughing. Maintain a distance from other people. Even when you go to shopping, most of the shops when you go, and especially here in the US, you're supposed to stand 6 feet apart. You have to be 6 feet apart. Make sure you observe that distance. No handshake. And also you have to monitor, to do what you call monitoring and self-isolation. Those are some of the ways you're supposed to, self-isolation to people who you suspect they are infected. So don't stay close to people that you're suspecting that they may be affected. Authorities worldwide have responded by implementing travel restrictions, quarantines, curfews, workplace hazard controls, and facility closures. So these are some of the ways the world or global countries have responded in fighting these this virus. So the pandemic has led to severe global socio-economic disruptions. So where we know that there have been postponement or cancellation of sporting or sporting event, religious. We know many churches, they're not operating right now, political and cultural events. So these and also the widespread shortage of supplies exhibited by the panic buying, where people, they think that probably this thing is going to lock down everybody, and there may be not be a time to be able to do shopping and all that. And also, you know, the schools, the universities, the universities, they have closed either on a nationwide or local basis. So in that has affected over 193 countries, affecting approximately 99.4% of the world student in population. So misinformation about the virus have been spread online a lot. So it's good you may be able to know what are preventive measures you're supposed to follow, so that you can take care of yourself and take care of your family, out there, because you do not know, because you have children, you have children, you have relatives, you have people that you want to make sure that we break the cycle and the spreading of this pandemic. And I believe that we're gonna win this war. So disclaimer, I'm not a medical doctor, but that is what I know, or what we know concerning the COVID-19. It was discovered in December in China, Wuhan, and that's why it's being called COVID-19. So see you in the next segment, and thank you very much. Take preventive measures and you shall be safe, you and your family, because we want to have a healthy global and a healthy nation. Thank you very much.